Greetings, friends and followers. This is Nurses Talking, and I am Dale Barcy. As always, if you like what you see and hear, subscribe. Leave us a comment. Let us know what you think. Here in Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey. And today I have the very great pleasure of welcoming Susan Adair out of Utah, USA. Susan has been a registered nurse for 28 years. She's worked through many different areas of nursing. She is the founder of Thrive55 Nursing Advantage, which she says is built from real cost, learning, and clarity that comes with a long nursing life. And she says that what interests her most now is the through line of a nursing career, the way we start, changes us along the way, and how nurses who still love the work can realistically stay in the workforce until retirement and do it with dignity. So, welcome, Susan.
Well, thank you, Dale. I appreciate you having me, and I really appreciate the opportunity to be here and to talk about nursing and the journey of nurses.
So, thank you so much for coming. But first of all, then, the first question I always have for everyone is why they're a nurse. So, what brought you to nursing?
When I was 14, my mom came home, said that one of her coworkers' daughters had started as a candy striper, and if I was interested in that, I thought sure. And the first time she dropped me off, I remember getting out of the car and looking up at the hospital, and the building just impressed me. Just how grand it was, how big it was, and kind of the movement all around it. I remember going through the glass doors and walking in, and just the sights and the sounds. It's very vivid. Those emotions of how much it drew me. So I really, really did like it. I went twice a week. I looked forward to it every time. As a candy striper, one of my jobs was to go around to the units and pick up various receipts, whatever, that had to go back to different departments.
Yeah.
So I would pick them up and take them to pharmacy or take them to the laboratory. And then they had miscellaneous pieces of paper. Again, no computers.
Yeah.
I would take the papers and deliver them back to the units. So I was able to go all over the hospital, all over the different departments. Sometimes I got to go behind closed doors and locked doors. It was very exciting. I really, really liked it. After being a candy striper, when I was 16, I learned to drive. I loved to go on long drives in my yellow Volkswagen Bug. It was a 71 Bug. And I would drive up to Salt Lake City and park in the hills behind the children's hospital up there. And I could look over the whole city. And I would park and I'd look at that hospital and think, someday I want to work in that hospital. Years later, my first year of college, there was a class you could take where you were able to take 3 weeks and go to the department that you were interested in. And I wanted to be a radiology technician. I thought that would work for me. I went to radiology, and every time somebody would come in and they'd bring someone in, I'd ask the person I was following, "Oh, why are they here? What are we doing? And oh, what are they looking for? And how do we know what it is? And what do they do after?" And I did that all the time. And sometimes I would get an answer of one part, maybe an answer of another part. Almost always, nobody knew what would happen afterward. At the end of the 3 weeks, the main gentleman that I was following took me aside and said, "Sue, do not go into radiology. You need to be a nurse." He said, "You care way too much about the whole story." He said, "You're going to get the whole story if you go into nursing." I still wasn't quite convinced. But years later, after investigating, I decided, yes, nursing was for me. At the time, there was a 6-year wait to get into nursing schools in the community college in Utah.
Yeah.
And that was before all the schools that we have now.
Yeah.
And California had a 2-year wait. And I thought, well, if I have to wait 2 years, I'm going to the beach. So I packed up my car, all my belongings. I had $800 in my account, and I drove by myself to Huntington Beach, California. Once I was there, I was going forward.
Good for
And
you.
so I went to nursing school, and every department, everywhere we went, I thought, yeah, I could do that. Yeah, that would be, that'd be okay. I could do that. And none of them really called to me,
Mhm.
but none of them were like, don't do that.
Yeah.
So
Yeah.
the last semester, when you get to go into newborn ICU, I went in there and they were measuring medications to zero point 0.01.
Yes.
And I thought, oh, that's me. I'm home. I am home. So I made myself known to that nurse manager. And shortly after graduation, I got into their new grad training program. And that's where I started, was the newborn ICU. A little bit later, I decided to move back home to Utah to my mountains. I left the beach, went back to my mountains, and I got a job at the Primary Children's Medical Center in the newborn ICU. And that was that exact hospital that I
Yeah.
used to park behind and dream about working there when I was 16. So that was like my full circle
Yeah.
moment of getting back to nursing, or getting into nursing
Into
back home.
nursing. Yeah, yeah, yeah.
Yeah.
Isn't it interesting when your whole thing comes together?
Yes. Yes.
Yeah.
And the journey's fun. For me, especially, just everything was new. Everything was discovery. Um, like I
Yeah.
was old enough to appreciate, I was 26 at this time.
Hmm.
And so I was old enough to appreciate being on my own and the independence
Yeah.
that comes, and how good it feels to succeed at something. So yeah.
Okay, so really you followed a path really towards nursing that kind of like different, did not deviate. But what challenged you when you got there?
Well, so I would say the challenges for me were internal.
Mm.
So I'm very competitive by nature, but not with others. I like to challenge myself.
Uh-huh.
And so early on as a nurse, it was really important to me to get a really solid knowledge base. I
Mhm.
wanted I wanted to know the ins and outs of disease process, of symptom, how it manifests,
Oh, hmm.
what you see, and not only to know that, but be able to communicate it to, well, at my time it was parents, right?
Yeah. Yeah.
What was going on with their babies. And so that drew me a lot. It wasn't necessarily a challenge, except for an internal
Yeah.
challenge.
Yeah.
Um, in
I
that
get that.
newborn, that being able to learn it and then to teach it,
Yeah.
that you can teach it with confidence. You, you know, that's one of the things that a lot of
Yes.
patients say on it about an experienced nurse
Yeah.
is the presence.
Yeah. Hmm.
They they come in with a confidence, and
Yes. Yes.
they have the background. That was important to me, and it served me well. Just a
Yeah.
quick story about the newborn ICU. I was at a level 4,
Hmm.
uh, and it was the last. So Primary Children's Hospital, it's a standalone. And so when you
Mhm.
do the newborn ICU, it's not a baby coming directly from labor and delivery. Lots of times the babies there have not progressed well in the other
Uh-huh.
NICUs in the
Mhm.
surrounding states and within the state. So
Gotcha.
by the time the babies get there, often it's very, very dramatic,
Yeah.
very emotional. And that department taught me really well how to have and not be afraid of talking about the hard emotions and the, well, life and death
And then,
and moving forward and empowering the families that how to tap into their resources, how to find that inner strength within them.
yeah.
I I taught a lot about self-care for them. I know that's your thing, Dale.
Yeah.
I can't necessarily say that I internalized it when, I know you're going to ask me that later, and but I was very good at teaching it.
Yeah.
Um, so there's an art the newborn ICU nurses have about calming a sick baby, and it's a skill that's so underrated. Babies can be irritable in the first place, but when they don't feel good, and it's
Hmm.
a baby and you've got that, you want them to be comfortable. And then the science behind it is you want them sleeping.
You want them.
You
Hmm.
Because that's when the growth happens. That's when the healing and
Healing.
the
Hmm.
the brain does what it's supposed to be doing. The body is doing the physiological
Yeah.
changes to heal. So you want babies in that deep sleep. Heart babies, they just can't grasp that self-consoling yet. A pacifier kind of works. There's a cute few little tricks that kind of work.
Hmm.
Um, and so one time I had a heart baby, and I had was doing all my things to get him to sleep. I had dimmed the lights. I had made it very quiet. Everything was calm. I had the pacifier. I'm like holding it just right and doing like pressure with one hand support and doing the nice little rhythm on on his
Yeah.
bottom, just really trying to. And then he went to sleep. He went to sleep, and I was like, yes, I was really proud of myself. And I went to do my other baby because usually you have one more stable and one higher
Yeah.
acuity. I
Yeah.
went to work with my other baby and do the cares and the meds and all the things. The front announced that grandma would be coming in for the other baby. And I thought, okay, when she comes in, I'll make eye contact and, just give her a little smile, and then I'll whisper, he's sleeping.
Yeah.
So she comes in and we barely get eye contact. And she rushes by me, and I'm like, uh-oh. And a few minutes later, I hear grandma, ah, boop, 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 ah, boop. I took a deep breath and I went over, and grandma had this look on her face like, help.
Hmm.
And I put my arm around her, and nurse mode kicks in. And I said, Grandma, let's talk about what's going on, And
Hmm.
so I was able to teach about what's going on physiologically on the inside and what
Hmm.
what we're seeing on the outside,
Right.
and why the whole reason why he's hard to get to calm down.
Hmm.
And you know, a cooing moment, an abu boo boo is not the
Right.
right time. It's
Not the
not the
right.
right time for that. But she didn't know why.
Yeah.
And so being able to teach that and combine the understanding for them with what they're seeing. And then, I had grandma, okay, let's change, grandma's in there changing the diaper, and we're talking, and he's got lines and tubes and you're just trying to normalize things for them. And that little interaction right there, that's newborn ICU. The
Yeah.
knowledge here and being able to make a
And
connection to teach and to help them see
to see.
the future and what they can do. Yeah, and I taught grandma at home. He's going to have times like this. It's important you know what to do at home. You can teach other family members. Now you've got the knowledge, that kind of thing. So I really like that about newborn ICU.
So I want to ask you though, um, as I listen to you talk about being in the with newborns and stuff like that, I can get that this was such a passion for you. And but now you have kind of switched a little bit and you are focusing on nurses. You just started a business. You're focusing on nurses who are 55 plus. And so I want to know what made you focus on these particular nurses?
Well, that competitive side of me, that nature part of me, when I when I would learn a new department or when I was learning something new, I couldn't help but jump in 100%. And the more I can internalize it, I I always practiced using whatever any of my five senses, whatever I can use of my five senses to make that learning process faster and deeper. And that helps me make the connection to be able to teach it.
Yeah. Okay.
What I did not know, Dale, is that that's the way of doing that is there's actually a price. There's a cost. And at the time, it feels good. Um, I think a lot of nurses have that same experienced
Yeah.
nurses have the
Yeah.
same thing where as they've gone along and they've learned the different departments, uh, you know it, you can teach it, and you're getting the positive
Feedback.
feedback of being good at it. And all that's wonderful. That is the feedback that makes the nurse identity, that identity of becoming a nurse,
Mm-hmm.
so strong.
Mm-hmm.
And you don't really even feel it happening until 20 years later. And you think of yourself, almost always first comes out is, I'm a nurse.
I'm a nurse. Yes.
That is the feedback of how it happens. Um, and so knowing that just gives you power on where to put your focus for your self-care.
Mm-hmm.
Now I know that. Now I understand that. My journey of getting to this point, I worked in IV therapy, outpatient
Mm-hmm.
oncology. I did that for 10 years. And that department is fantastic because you get every single system in the body
Yeah.
with cancer.
Mm-hmm. Yeah.
And and so it's not just breast cancer, it's breast cancer with kidney disease.
Yeah.
It's, colon cancer with a heart
But
condition.
yeah. Yeah.
And so you really, really get to know your diseases, what's going on, how it's manifesting, and being able to educate about it. And then the communication part of that was always very important to me. Also, with that department, medications, there's
Mm.
a lot of research. You're exposed to research on
Yeah.
medications, on treatments.
Yeah.
Uh, Medication and treatments bring money to the hospital. Anything that brings in money to a hospital gets a lot of attention. So we were kind of spoiled in those departments. It was nice.
Yes.
They also, with chemotherapy, very high risk, and everything's very detailed. And I've always liked detail, down to the little bit.
Yeah.
Also during that phase, like that was the thick of it for me. That outside of work also, like life. I was a mother. and a wife and a caregiver daughter. And all of those things take 100%. And as a nurse, you know that, and you're going to do it. Like the mindset is, this has to work. This has to fit.
That's it.
The reality is 100% plus 100% plus 100% plus 100%
Yep.
does not add up. For me, in that equation, to help make that work was to take me out of the equation.
Out of it. That's right.
I have chronic medical conditions. I had those conditions at that time also. I did what I had to do to keep going. And I often thought, like when I had to have a surgery or something, okay, I'll do the surgery to get me back.
Yeah.
That was the purpose. The purpose wasn't so that I could heal and grow and, be
Yeah.
healthy. For me, the
Yeah.
purpose was I need to get back.
Yeah.
And a high percentage of nurses, that is how it works.
Guilty.
Yes, yes. So when that equation stopped working for me, well, I would switch departments. When it started not adding up, I would switch
Ah,
departments. So, I did 6 years in newborn ICU. I did 10 in
in
oncology, and
oncology.
then I went to clinical documentation integrity improvement. That was fun. Have you worked in that one or have familiar with
I
that?
felt familiar. I'm familiar.
Yeah, that was fun. And that's that was like learning a whole new language, a whole new culture that's
Yeah.
completely the business side of healthcare. And you you are making sure that what the doctor's
All
doing
dots.
and the
Yes.
treatments and all of the
Yeah.
things that are being done are being captured,
Yeah.
and captured meaning for reimbursement,
Yeah.
right?
Yeah.
And the language that I had learned for 20 years in medical as a
Yeah.
nurse is not the same
It's
language.
not the same. So
And insufficiency in the business world means nothing.
yeah.
The word they want the word failure, and the doctors are like, they're not in kidney failure, it's kidney insufficiency. And yet you're doing the treatments, you're getting the labs, you're doing the
Yeah.
meds, you're doing. And so, educating on the terminology, and how that,
On both sides.
yes, and how that has to meet in the middle,
Hmm.
uh, for compensation. But that was
Yeah.
fun. That was a really good one. A lot of nurses don't know what that one is. Can I take a minute just to kind of explain that?
Absolutely. Absolutely.
So with clinical documentation integrity, you start. Let's say you're looking at the H&P, and you've got the H&P, and you read through it. And as you read through it, there's like 5 buckets of information. So there might be, one for, I can't even think of example, but different buckets, and there's at least probably 5. And you put them in the buckets, and then you read like treatment notes and results from X-rays and MRIs, and you just read it and put it in the buckets.
What's this in there?
Sometimes you see what maybe could go in the bucket, but it's just not quite the right wording, or maybe it's just one piece. And so as you're reading the other documents, you grab those pieces. Oh, these 2 pieces fit. That makes
Good.
this go in this bucket.
Mhm.
And so it's kind of like a puzzle. It's very cerebral, and
Yeah.
it relies a lot on your past experiences with
On your
health,
knowledge.
on your knowledge base. Yes. Also, you learn how to fine tune that knowledge base, because it's those details that are translating to reimbursement.
Yeah.
making sure if it's renal failure, what stage of renal failure, because
Mm-hmm.
depending on the stage is a
Stay.
different
Mm-hmm.
reimbursement. Yeah.
Yeah. Yeah.
Um, and how Medicare drives,
Mm-hmm.
the financial part of it.
Yeah.
That that was really fun, and being able to sit with executives of hospitals and in those meetings, and you're eating your pasta salad next to the CMO.
Mm-hmm.
That's
Mm-hmm.
it's fun. It's it's exciting. Um, why was it? Oh, I just wanted to tell you how it worked.
How it
Yeah,
works. Yes.
yeah.
Yeah.
And
So.
what happened to me that started my equation not working was when I was reading like one document, I started to only get three things to fit the buckets. And then I'd have to reread it.
Yeah.
And I'd reread it and I'm like, oh, there it is.
Yeah.
And then it got to where I was only like say I was only getting two. And I'm like, wait, there's got to be more. And I would go back and reread it. And oh, there's two more. And then I'd reread it. So I'm reading it three times. And that's when I started to think, I'm
Happening
slowing.
here. Mm-hmm.
Something it
Yeah.
um and also with chronic medical conditions, you end up taking more treatments, more
Yeah.
medications.
Yeah.
And with that, after years of doing that, the doses go up and the side effects show up.
Mm-hmm.
They
Yeah.
show up more. I moved out of clinical documentation
Mm-hmm.
integrity. I got to the point where I was an empty nester. That changed the variables of my
Yep.
equation. And with that, I started to feel like being called back to the bedside. And I had a really strong need to connect with the patients and
Mm-hmm.
have that hands-on direct patient care. Also, I felt like if I could move more, move my body more, that
Yeah.
I could manage some things a little better. So sitting too much isn't good for you. Standing too much isn't good for you. Uh, so I did get hired into acute care dialysis.
Huh?
So there's acute care and chronic
Yes.
care dialysis, and
Yes. Yeah.
yeah, and that's the outpatient. The patients are healthier. They
Mm-hmm.
have kidney failure, but they're coming in and out. In acute care dialysis, it's in the hospital. Often it's in the ICUs. Maybe there was a car accident where, the kidneys got hit,
Got
or
injured. Mm-hmm.
uh, a heart disease patient who had surgery and the kidneys just, shut
Yeah.
down, different things like that. And the best part, I really, really liked that job. Uh, the parts that I loved about it was you get there's blood, there's needles, there's computers, there's technology, there's machinery, there's the patient. You get to have staff interaction. I got to be in the hospital again,
Yeah.
put on those scrubs, that uniform, and just represent myself as a nurse again. Uh, I really, really enjoyed that. And the so it came to the point that as much as I love the physical, often, often, you are on your feet standing. You're not even really able to move around.
Mm-hmm.
Um, and that standing in one place is very difficult.
Yeah.
And I loved the machinery, and like you have to get under the sinks in the rooms
Mm-hmm.
and hook
Mm-hmm.
up the hoses to the water supply, put the drain lines in.
Mm-hmm.
You're putting like chemicals and connecting everything, and that's fun. But even getting under the sink, um, I would carry
Mm-hmm.
around pliers pliers with me to tighten the connections because, just
Yeah.
the strength,
The
well, for me
strengths.
anyway, my strength was going.
Mm-hmm.
Uh, so my workarounds stopped working. My workarounds to my workarounds had
Mm-hmm.
stopped working.
Mm-hmm.
And I was in survival mode.
Mm-hmm.
I was in survival thinking. And I was working at a sister hospital. And as I was leaving for the shift, there was a nurse in the employee help department, and the door was open. And I took off my name badge. I didn't want anyone to associate my name with, whether it's real or not, you have a fear that
Yeah.
it would be connected. And just like many nurses, nobody knew what was going on
What's going on? Mm-hmm.
with me. And millions of nurses do the exact same thing. And I went into that, and she was super, super kind. What a what a beautiful, beautiful lady. She invited me in and closed the door and assured me that it was confidential. And I was able to just say it
Mm-hmm.
and just get that off my chest, what was going on. And I asked what kind of options I had. Was there a program? Um, and different things. And she talked to me about medical accommodations with the ADA.
Mm-hmm.
I had no idea what it was. And as she was explaining the process, in my already stressed out mind, it felt like one more weight on my head, hearing what it took to get that. And I just remember like my hope, just
Yeah.
sinking. And as I was leaving, I said, does our company have anything that helps someone like me? Is there some sort of advocate for nurses that are 55 and over? I'm like, I can't be the only one in this.
Yeah.
She said, no, you're not the only one. There's several. Um, and I went home that night devastated. I did not know what I was going to do. I had been trying for other jobs. I had been
Yeah.
interviewing. I had been trying. I'd gone to several interviews. I was not getting them. I also knew I couldn't go backwards because I didn't have any workarounds to make my other
To
stuff
make,
work.
yeah.
Uh, I got home and I took off my scrubs. I remember looking in the mirror. I felt like I was like taking off armor, you know, my protection.
Yeah. Yeah. Yeah.
And I took that off. I looked in the mirror and I had my back brace, lidocaine patches, kinesiology tape on my legs, compression socks. And I just thought, how many more years can I do this?
Yes.
And, you know, so that moment, that exact moment is when I realized nursing was not built for longevity. It was not built for nurses
Mm-hmm.
to be able
Mm-hmm.
to last till 65 in a nursing career.
Mm-hmm. Mm-hmm.
And that was a lot of the weight that was on me is medical insurance, financial.
Yeah.
Uh, Besides my identity,
Yeah.
I had I had responsibilities,
Yeah.
and I did not want to go on disability. I wanted to work. Like
Mm-hmm.
I wasn't done. I felt like I had a lot to offer. I felt valuable,
Yeah.
and I felt stuck. And that is what led me to build Thrive 55, Thrive 55 Plus Nursing Advantage. And so I focus on experienced nurses, 55 plus, that want to stay in their nursing careers until retirement.
Yeah.
That's my whole focus. Um, that's what I'm doing now. I am away from the bedside. I've got a new identity as a nurse. We talked about how that transition is
Yes.
it's very,
Yeah.
very painful.
Yes.
Um, and I feel like I can contribute and be useful. So for me, it's been a godsend. Older nurses have a lot to give,
A lot. A
and they're
lot.
very, very valuable. Dale, I don't know if you're aware, but the average age of a nurse leaving the nursing profession is 58. Retirement, well, it was 65. Now it's 67.
Now it's 16. Yeah.
And the ones that are leaving at 58, only 18% of them are leaving because of retirement. The rest, the number one thing they have said is physical pain.
Yeah. Yeah.
Yeah.
Yeah.
So my focus is to help nurses in that scenario. And
Mm-hmm.
it's very I guess narrow, specific, and I completely understand where they're at. And there are ways to work with it. Now that I've been able to step back,
Mm-hmm.
now that I've been able to focus and learn, like I said, learn 100%, um, I know way more avenues on how to help those nurses. And that's what I'm doing now.
So I have two questions. One is nurse, how big do you want to see this? And how do people get in touch with you? Because you know what? There are more nurses approaching that age group than there are younger nurses.
Yeah,
And so you
40% of the workforce is 50 and old, 50 and over.
okay.
And the
Okay.
ages from 50 to 55 is 50 is where most people start noticing, like I did
Mm-hmm.
with the reading the
Mm-hmm.
document. And 55 is when it really starts to impede. Um, uh, I remember being 50
Mm-hmm.
and hearing of coworkers that were really struggling. And I remember thinking, oh, I'll change departments.
Yeah.
And
Yeah.
that's
Thinking
often
it
what
was the department, but it's not the department.
no, no. Um, yeah, so the definition of burnout, which I
Mm-hmm.
definitely felt, is the chronic stress in a job environment with not enough recovery,
Mm-hmm.
without efficient or enough to relieve the stress
The stress.
of
Mm-hmm.
that time, compounded over time.
Mm-hmm.
That's burnout. So that's the equation. Um, and our jobs are built to make that equation.
Yeah.
And that is another one of my focuses. And that um, when you ask how big I want to get, because I'm very competitive and I love a big challenge, uh, I I I feel like this could be a big movement,
Huge thing.
and I would love to be a part of it,
Mm-hmm.
and have the conversations and get people talking. Uh, I do have one step. I thought, okay, I need to give Dale one step because she's going to ask me about that self-care.
Okay,
Uh,
yes, I am. Well, go ahead, tell me.
okay, so, and I've already told you the mindset that I was in
Yeah.
of you have to make it fit.
Yeah.
Um, so my one step is for an experienced nurse on the shift, make it a no matter what, you are going to get a lunch. I told this to a business coach that I'm using,
Mm-hmm.
and she said she couldn't get it. She's like, well, I don't mean to sound, but getting a lunch? She's like,
Yeah.
everybody gets a lunch. What do you mean getting a lunch?
No.
No. And that also was an awareness to me that when you're not in nursing and nurses say they're too busy to get a lunch, it's really, really hard for people to understand,
Yeah.
including the executives in the
Hmm.
healthcare arena.
Yeah.
And they might have days where they don't take a lunch,
That's not every day.
but they're not, it's not, yeah, it's not, and it's not because someone's going to be sitting, for example, somebody might be laying in stool
Yeah.
and you want to take a lunch
Hmm.
or you're on your lunch
Hmm.
and there's everybody else.
You
You're not
just
going to
can't.
pay your patient like that. You're not going to. We're
Yeah.
nurses,
Yeah.
you know, or if somebody's got a blood pressure problem and you're on your lunch, you're not going to wait. Oh, I'm
You're
on my
not gonna.
lunch, you
Yeah.
know. Uh, and then also you don't want to put that on your coworker. Your coworker's as busy as you are.
Already doing it.
All right.
Yeah.
So we all know the problem. My one step then is to make that a priority of taking a lunch. At the beginning of the shift, you go to the charge nurse, the supervisor, the manager, whoever it needs to be, and say, I'm setting a goal for myself to take my lunch, and I'm going to make it a goal to do it for 2 weeks, even though, right, you want to do it longer, but
Hmm.
you're you're communicating 2 weeks. How can you help me today? Or I even say, I've told a couple nurses, don't ask how, just say, what time would be better for you to have me
You.
come?
Yep.
I I can go anytime between 12 and 3.
Hmm.
You know, what time is going to be best for you? Not can you or will you, it's
Yeah.
when you do it,
Yeah.
that kind of thing. Now, the second thing is to put it in writing. What I mean by that is an email
Hmm.
addressed to the supervisor, the manager, and
Hmm.
in that you say basically the exact same thing. I'm setting a goal for myself, or I know you appreciate that our units has strong, healthy nurses.
Hmm.
Because of that, or to add to that,
Right.
I
Hmm.
have made a goal to make sure I take a lunch. I'm going to ask at the beginning of my shifts, I'm going to come and find the charge nurse and verify when would be a good time for that.
Hmm.
And you say that so that they are aware, it's in writing, and then you CC 2 or 3 people above that.
Yeah.
So the manager and the manager and the manager. And you don't do that because it looks manipulative unless you put in the email towards the bottom. I have purposely included
Hmm.
boom, 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 because I want everyone to know that this is an important goal for me.
Hmm.
You're not saying because I don't get one. You're not
Yeah.
saying because your unit is broken. That is something I say though, is if it's too busy to get a lunch, you're not busy.
Hmm.
It's broken.
It's
It's broken.
broken. It is broken. Yes.
Yeah. And so do it in writing. And then the third part of that, Dale, is to do it and to vocalize every day to a coworker, to somebody, I'm setting this goal for myself. This is what I did. This is what I'm doing today. That, and
Hmm.
you do it every shift. What that does, just like when I put my arm around grandma
Hmm.
and I taught her how to interact. She wanted to interact with her grandson
Yeah.
in a, and I taught her how to do it in a healthy way. And then she can go home and teach her
And
family.
teach. Yeah.
And it's the same principle here. You make the goal. You want to take a lunch. That's the self-care that I am challenging
Challenging. Hmm.
experienced nurses to do, is to take that one step. And that everybody else will think, okay, that's crazy.
Yeah.
Of
Yeah.
course, you're going to get a lunch. And unfortunately, it's not a given.
It's not a given. It's not a given. It's not a given. I did that in a different in a similar way.
Oh, I'd love to hear.
Because I used to walk,
Uh-huh.
um, take a break to walk. And it just became known that so Dave was out for a walk. It didn't have to be a long walk. It didn't have to be, a half an hour or whatever it is,
Yeah.
but I was going to go out to walk. And people realized after a while. And the thing is though, that I must say that when I did that and when I made it clear that I was doing that, I was my own department head. And so it made it it made it easier for me to do that. But also, it set an example to other people that a break was needed. You're going to
Yes.
take a break. Um, and
Yeah.
and and I found that that eventually worked very well, actually.
Yeah.
I didn't
Can
tell
we
other
talk
people what they had to do, but people took a break.
can we talk a little bit about even the science behind that?
Yes.
Do you have a minute?
Yes, I
Um,
do.
so studies show that if you can take a minimum of 11 minutes every 90 minutes and get off of your feet. So if you take the load, the weight of your body weight off of your feet,
Mhm.
11 minutes is the magical number to get the muscles and the fibers and the cells in that restorative mode. So up until that point, you're putting this stress on them and you're not breaking them down, but it's stress
Mhm.
at 11 minutes. So that's the science behind that. Also, as far as the 30-minute break, so during the day when you're on your shift and you are doing your things and you've got your handful of patients, two handfuls of patients, and you're keeping that in your head and you're being called in several different directions.
Mhm.
There's you're thinking about medications. You walk into one of the rooms and you're looking at the monitor and you those numbers and you are like, okay, I've got to watch that trend. And
Yeah.
that's in there. That's in there. Somebody else needs a pain pill. So, all these things are not only are they information, they're uh, important
Really
information.
important. Hmm.
They're all of equal importance. And so it's in there, and you're putting a high priority on those things. And also, even someone, I shouldn't say even, but someone who is in uh, a dirty stooled bed, that's very important
That's
because we know,
important. Yeah.
yes. And so all these things are in there and it's working around. You've done that, and now you're able to take your 30-minute break. When you're on your 30-minute break, if you purposely breathe and purposely relax your mind,
Yeah.
even read a newsletter, you can look at your social media, something to just kind of take your
Something.
mind
Hmm.
off of it. The 30 minutes, and the reason it's 30 minutes is because that's the amount of time it takes for all that working memory to have some of it start going into short-term memory and to
Mhm.
move to make room for more working
More.
memory.
Hmm.
And when it goes into the short term, you don't have to like make yourself sticky notes. You don't have to, it's your brain is going to remember. Your brain's going to
Hmm.
remember the trend of the vital signs. And that space that you were having to keep it right there is now available.
Available. Hmm.
What that translates to is less stress on your body. So that's the key of 11-minute and of a 30-minute.
30 minutes.
And we're always thinking we can't take the break because of the patients and they need us and we're not going to let them not, or the
Right.
charting, right? The charting. Um, You don't want to be there for 15 hours.
Right.
But understanding that you will be able to chart better and
Yeah.
clearer
Yeah.
because you took the 30 minutes, the memory is going to remember what even goes into your charting. And so when you're sitting there and you're like trying to run through it and capture everything, you actually save two
Yeah.
minutes. And when you've got 12, however many charts, however many things you have to do,
Yeah.
that, I mean, you can
That's a
save
lot of
30,
time.
40, that's a lot of time.
Yeah.
And so that's just my some science behind the importance of it.
Yeah, yeah, absolutely, absolutely, um, beneficial, beneficial. And it takes a while to see, for you to grasp how beneficial it is if when you start doing it. But then you see it, because you do see those nurses who never ever take a break and yet are there 15 hours, as you just said. And that's because they didn't really take a break. And they would argue that if they took a break, they would be there 16 hours, but that's not really true.
Right, right. And so that that sign right there,
Hmm.
that's one of the signals for me.
Hmm.
That's what I'm doing. It's I have like three core areas I look at: physical, cognitive, and workflow. So an
Hmm.
example like that would be cognitive.
Yeah,
And the charting, they have an ineffective behavior of the way they're capturing the information,
yes,
the way
yes,
they're storing it, and the way they're recalling it. And I can improve those.
yeah,
So we work together. We identify where you're getting stuck, where the bottleneck is in your
yeah,
workflow, where those trouble spots are. We break it down and so that we can see the pieces. And then we come up with a plan, put it back together, and you try it on the next shift.
yeah. Exactly.
Yeah.
Exactly. Exactly. Susan, this has been such a conversation. It's been so full of information. I think we have to do this again. There's so much more we have to talk about.
I would
But
love to come back. Yes, anytime.
thank you so much for this. There's so much information that you have shared. Um, I'm going to ask you to send to me, though, ways that people could contact you that I can put it in the description box. Because what you're
Yes,
offering is so big and so huge and so very necessary. And so very necessary.
yes,
Really,
I'd be honored. I'd be honored. Thank you.
so please do that. Please do that. But thank you so much for this. Is there a last gem you'd like to leave us with?
Uh, oh my goodness, I shared all my thoughts.
That's okay. That's
Oh,
okay.
I do have one more.
Good.
Once you get me talking, Dale, I can go on. I have one more.
Yeah.
Now, this is one I did not discover the importance of until I was 50.
Hmm.
Go to therapy before you need to go to therapy.
Yeah. Okay, that's a big one.
Now, I had often had the mindset of I will go
If I
if
need to.
I need it, when I need it, when something is a struggle, when there's a problem. And now, so that's when I did, right? That's when I went. But that was
Yeah.
the error that was a thinking error because you go before you need to go. That's another way to help yourself stay in nursing until retirement.
Yeah. 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 I can see that. I can see that. It fits you for the difficulties ahead. You're a little bit better prepared.
Yeah.
Yeah.
It even applies to relationships, right?
Yeah.
For yes,
Yeah. It does.
a couple, a partnership, is anything. Go and talk about the way you think, your beliefs that you're carrying with you, your struggles, your fears. Start learning a healthy way of working with it. And so just like you're still going. You've got multiple things you're doing and all the little tools that we've talked about help keep you moving.
Yeah. Yeah, indeed they do. Indeed they do. Thank you so much, Susan. It has been really a joy talking to you, truly. Thank you so much.
All right. Thanks, Dale.
Okay.